and thank you for joining us on this Thursday. Today, Mayor Demings is here with information on Tropical Storm Isaias and what our weekend will look like regarding weather. As you know, it's looking a little dicey out there for the weekend. Mayor Demings will talk about that a bit. Regarding the coronavirus, he will also discuss positive cases and, sadly, an increase in the number of deaths. The mayor will also talk about CARES Act funding and where we are with that. Mayor Buddy Dyer from the city of Orlando sends his apologies. He could not make it today to this press event, so he apologizes. Dr. Raul Pino from the Florida Department of Health in Orange County has information on our testing numbers and other data with respect to the trending of the numbers in this virus. We start with Mayor Demings. Mayor.
All right, good afternoon. Welcome to our typical press conference regarding the COVID-19, but before I get into that, let me just talk briefly about the weather phenomena that is emerging. Of course, you all know that Tropical Storm Isaias is developing just south of the Florida Peninsula. The tropical storm is forecast to approach the coast of Florida by this weekend, according to the National Hurricane Center. Earlier today, I had the opportunity to meet with my staff here within Orange County to ensure that we are prepared should we be impacted directly by the storm itself. Right now, wind speeds in Central Florida are projected to be between 35 and 55 miles per hour if the storm impacts us, and we're expecting 1 to 2 inches of rain. So it's really too early at this point to definitively say what will happen. But if it doesn't worsen, it will be no worse for us than one of our typical summer storms. So we are going to plan for the worst and hope for the best in this process. But more information will be coming from the state emergency management officials at 5 p.m. My staff will be on a conference call across the state to talk about the current track of the storm. But in preparation for this weather event, our Orange County Health Services testing site that is located at the Econ Soccer Complex will be closed for the next few days. Depending on the weather, the testing site is slated to open next week, next Wednesday, at the Econ Soccer Complex. In addition, the regional state testing site at our Orange County Convention Center may also through Wednesday of next week, and that's so that they can button down all of the equipment there. A decision will be made in probably just a few hours whether or not the state would temporarily shut down the Convention Center testing site. So stay updated. You can get information about all of this on our website at ocfl.net/coronavirus. As we monitor the path of the storm, please know that our emergency management team is ensuring that we're prepared for rains and the wind gusts. The emergency management team is also working on special needs shelters and other protective measures should we find ourselves in a storm activation situation. I also want to note that Orange County stands ready with plenty of hotel rooms here should there be some type of evacuation order for the coastal areas here within Florida. I urge our residents to follow Orange County's social media channels and your local media and visit ocfl.net/storm for more preparedness tips. We've been very proactive, as you know, here within Orange County. In light of the weather conditions, Orange County's free sandbag giveaway has been underway for about a week or so now, and we will extend the free sandbag giveaway through Saturday. The hours are 8 a.m. until 8 p.m., and there are 5 park sites where you can get free sandbags and PPE. They are located at Barnett Park, the Bidlow Community Park, Downey Park, Meadowwoods Park, and the West Orange Recreational Complex. We've already given away nearly 40,000 sandbags to county residents. It does pain me, though, to talk about our COVID numbers at this point because within the last few days, we continue to see the death toll rise here within Orange County. Orange County now has a reported 212 residents who have died as a result of the COVID-19 virus. That is an increase of 38 deaths since Monday of this week. I attended a visitation just yesterday of someone that I've known for many years who died as a result of the virus itself. Dr. Pino will go over some of the details, but we recognize that each individual who has passed is someone's father, mother, sister, brother, or beloved friend. Orange County now has over 28,000 positive cases here within our county. To be exact, 28,591 is the latest numbers that I've seen. That's an increase of 408 cases over yesterday's numbers. On Wednesday, we had an increase of 374 cases. Tuesday of this week, an increase of 432 cases. And on Monday, an increase of 411 cases. In the midst of the bad news, the good news is that the daily positive rates have been below double digits for the past week. So our numbers effectively are declining. We have tested nearly 250,000 individuals, and our overall positivity rate, according to the state now, is 11.5%, which is better than the state's positivity rate. You can see a daily snapshot of our cases and positivity rate for the past 2 weeks. We kind of show it up. That's a relevant period of time, a 14-day period of time, and you can see that by going to our website at ocfl.net/COVID-19 snapshot. Behind me on the screen, you can see a snapshot of where we are presently. The compliance teams, strike teams have entered their second week of meeting with businesses throughout Orange County. So far, the teams have visited 300 different businesses. The good news is the compliance rate that we're seeing remains around 80%. Most every business in Orange County is doing the right thing and protecting their employees and patrons. So I have to applaud our businesses for at least being responsive to the direction that is being given here within Orange County. The CARES Act funding for individuals and families has now processed $14.6 million through our comptroller's office. That is where we give individuals and families $1,000 who need crisis assistance. There have been over 28,000 approved applications during this period of time. As for the CARES Act funding for small businesses, the program has seen 3,579 applications that have been approved. So far, that means that $36.4 million have been paid to small businesses in our community. After hearing from residents that our Business Cares program did not help home-based businesses, some changes have been made. Through the direction of the Board of County Commission, we are expanding our CARES program to include micro grants to home-based businesses with 3 or less employees. That group had not been in the eligible criteria previously. The grants for the small businesses that are home-based with 3 or fewer employees will range from $1,000 to $3,000. Again, this is for small sole proprietorship types of businesses here within Orange County. The other eligible businesses remain eligible, and those are the ones with 100 or fewer employees and those which have not received more than $75,000 in personal paycheck protection program dollars. In order to prepare to deal with the expanded eligibility, we will be temporarily shutting down the application process for our micro grants. Our portal will shut down tomorrow at 5 p.m., but we will reopen it. We're going to have it shut down so that we can clear out all of the existing applications. We will reopen the business assistance grant opportunities on August the 10th. So those who have already applied, we will close it down tomorrow and clear it out for about a week and reopen again on August the 10th for business crisis assistance. I'm optimistic that next week we'll make an announcement about when we will reopen the individual and family assistance portal. So that will come hopefully early next week. We'll give you an idea about when we will reopen that. And so with that, I'm going to turn it over to Dr. Pino to give you a more specific update on the COVID-19 developments here within Orange County.
Good afternoon. Thank you, Mayor. As the Mayor has informed, we have 28,591 positive cases cumulative during the pandemic, and our positivity rate as 11.5 overall. Yesterday, we received 4,517 negative results. We also received 408 positive results. That is for 8.3 positivity rate. All other indicators except death rate have continued to go in the right direction with regard to death. And there is a little discrepancy here in the data that I just noticed. So I'm going to go ahead with the discrepancy, and I will try to clarify it later when I go back to the office. The mayor said that we have 38 additional deaths. I have 39 here in my data. So, but we will have to clarify what had happened. Out of those 35 deaths that we have, 9 occurred in long-term care facilities. 16 females, 23 males, 11 were black, 3 were of other race, 23 were white, 2 unknown race so far. With regard to ethnicity, 3 were Hispanic, 14 were not Hispanic, and we have 22 that we don't know ethnicity yet. 35 of those 39 has significant underlying health conditions. 2 we don't know, and 2 are reported not to have any of pre-existing condition. You also asked us in the past if we have any multisystem inflammatory syndrome case in our county, and we have 1 case. It's not confirmed because it wasn't detected by lab, but it was clinically, and it is a 15-year-old female. With regard to long-term care facilities, I have a list of some facilities that we are following and monitoring closely. And Ocoee is not here, although you probably will have some questions because we want to bring the light into more facilities that are in this situation. So we are going to try to provide you with the 5 top facilities every time that we have a press conference. Now, keep in mind, all that data is publicly available in the website with the number of cases and what facilities. So Rio Pinar Healthcare Center has 195 staff members, 36 are positive. No death or hospitalizations among employees. Residents, they have 170, 18 positive, 7 have been hospitalized, 2 have died of the pandemic at that facility. Orlando Health and Rehab, approximately 400 staff, 56 were positive, non-positive or hospitalization, nor death or hospitalization among employees. For residents of that facility, 324 residents, 84 has been positive so far, 0 hospitalization, 1 died from COVID-19. Advantage at Orlando, 135 staff, 16 staff positive, no hospitalization or death among the staff. Residents, 103 residents, 41 positive cases. Now, with this facility, I have to give you the headline that it is a facility that is assigned and designed to hold positive cases. So we should expect to see a high number of cases there. Actually, 57 beds in that facility are dedicated for isolation and recovery of people with COVID-19. Colonial Lakes Healthcare, 226 staff, 27 positive, no hospitalizations or death among staff. Residents, 180, 36 have been positive so far. 8 residents has been hospitalized. 8 residents have died in that facility. Conwell Lakes Health and Rehabilitation Center, 190 staff, 19 has been positive. 1 of the staff require hospitalization. For residents, they have 120 residents. They have 24 positive cases. 4 has been hospitalized. 2 have died. With regard to hospitalizations for COVID-19, we have today, as yesterday, no, the 28th, I'm sorry, we have 89 people in ICU beds and 421 people in general hospitalizations. That is, the prior numbers that we gave you in that area was on July 25th, and at the time were 90 people in ICU beds, 481 total. So it has been a little movement on the right direction there. We also would like to report to you that our incident rate for positive cases has dropped to 248 from 359 that was our highest. Our recovery rate today is up to 82%, which is a significant increase from prior weeks. I also would like and continue to encourage people to wear masks, to wash your distance, and to wash your hands. It is critically important that more than ever we emphasize the protective measure that we have to put in place to prevent us from acquiring the disease, but also from protecting others. On another note, we continue with our immunization event at West Old Mall. Again, if you call 407-723-5004, we can give you an appointment. We have a schedule another week, next week, but we have seen a decline in the number of appointments. If that continues to decline, we will close earlier because our staff is also getting exposed to everyone that goes there, so we will try to have the least time there as possible. But again, if you need to vaccinate your child because he's going to school, new to the county, new to our school system, please have your children vaccinated before school year starts. With that, Mayor, thank you very much.
Okay, thank you, Dr. Pino. I do note that we have some Spanish-speaking media here today. If you have any questions in Spanish of me, I will ask Ms. Ilia Torres to come forward and help with the translation. Obviously, Dr. Pino is bilingual, and you can certainly ask your questions to him in Spanish, and he will respond in Spanish if necessary. So with that, we'll open it up for questions.
Mayor Lauren Seabrook, Channel 9. My question's for Dr. Pino, but a quick clarification from you on the state Orange County testing site. We had already been told by the state that it was closing down tonight, but it sounded like you were saying they hadn't made a decision yet.
We were told that they wouldn't make the final decision until after the 5 p.m. call. So the temporary plan was for it to close. So, but because of the latest track of the storm, there was a little bit of uncertainty there. So we'll wait for the official word.
Okay, thank you. Dr. Pino, can you kind of give us an idea maybe of what to expect with all of these testing sites closing for several days? How is this going to impact our numbers? Is this going to maybe give our folks some time to catch up with the backlog and that kind of thing? And what do you want people to know? Because I have a feeling next week, if we see lower numbers on certain days because of this, everyone's going to think, oh, we're fine now.
So that's a very good question. And Steve was also asking the same question. What could happen is, what I think would happen is that we will see an increase in our positivity rate because we will be doing less testing. And I think that the people who would really go for testing during a storm, if we have the storm, are people who are feeling really sick. So the probability of getting a higher percentage of positive results within the number of tests could be higher. So we should know that and control for that factor when we're doing analysis. Another thing you just mentioned could happen is also that we give labs the opportunity to catch up. If the entire state shut down these drive-through sites that are at risk of wind and other storm elements, we probably could see 20,000 tests less, something like that, around the entire state. So that could give the labs an opportunity to catch up, although many labs are reporting that are almost back to normal. But there's still some issues, yes.
Dr. Pino, Deanna Albritton, WFTV. Hey. For deaths, since we continue to see this rise doubling in just the last 2 weeks, what are you expecting as far as trends, especially as our median age continues to tick up?
So I think that what we should expect is, as I said before, about 50% of the people on ICU will die. And the number of people in ICU will give us an idea of what the death rate is going to be. We still have 89 people in ICU beds. If that holds true, we could see another additional 40 deaths in the next 3 weeks. But as the number of hospitalizations are decreasing, you suspect that the number of people in ICU bed will eventually decrease, and also decreasing the number of deaths. And that's a data indicator that always lags like 2 or 3 weeks after we see a decline. So I think if the data behave that way, we could see a decrease in the rate of which death is happening starting next week.
Doctor Pino, Oscar Pineda, WWFL. Están por abrirse las escuelas y las medidas de seguridad e higiene con el condado que tiene, esa es una pregunta. Y la segunda sería, los niños van a ponerse máscara y de qué edad es recomendable y cuánto tiempo la usarán.
The question in Spanish was, what are the measures that the county is taking, or in this case, the school board, to protect the children in the schools, and what age children should start using masks, and for how long do you think kids could keep their mask? So, todas esas son buenas preguntas, pero son todas preguntas para el Board de Educación, porque ellos están tomando. Nosotros tuvimos un panel de análisis que diseñó las medidas del Board, y la noche antes fue la noche que salió esa orden ejecutiva. Y entonces todo el plan que teníamos hubo que eliminarlo y comenzar de nuevo. Las medidas, ningún niño menor de 2 años se le pide que se ponga máscara. Deberían tenerla el mayor tiempo posible. Pero existe la posibilidad que dependiendo del tipo de actividad que tengan los niños, de cuántos niños estén en la habitación, por ejemplo, si podemos tener social distancing, y hay 10 niños en la aula y están todos sentados, es posible que el profesor les diga a los niños, nos podemos quitar la máscara por 5 minutos para darle un receso y volver. So the answer in English was that all those are good questions, but there are questions actually for the Board of Education who is implementing those measures. We worked with the board. We did an entire session in the afternoon on the steps that they were taking. But the night before we released that information was when the Commissioner of Education sent that emergency order. So that really raised everything that we did. So they are working in new steps, and all the information is online right now. But with regard to the question of how old children should be to wear a mask, no one who is younger than 2 should be wearing a mask. And for kids, and how long they are going to have it in the class, the longer the better. But it's not out of the realm of possibilities that if there is social distancing in place, if you have 10 students in the class and they're all sitting working on reading, there is a possibility that the teacher could, at their discretion, say to the student without, leaving your desk, you can remove your mask for 15 minutes so that we can all have a break. If the space is there, if the condition is there, that could happen. And we actually advise that it's better to allow people to have an area where they can take the mask if they feel overwhelmed by it, than forcing people to wear it, because we want to create the habit of wearing the mask. The same habit that you have putting your seatbelt, You get in your car and it's like a signal in your brain. It's a reflex. It's like click. I need that click. So we want that to happen.
Steve Hudak from the Sentinel. This is for both the mayor and you, Dr. Pino. With the test results, with many of the test sites being shuttered for several days beginning tomorrow, what data will you look for to kind of judge the health and direction of where we're going? Because we know that we're going to have additional deaths, so what are we going to look at?
So I don't think, so that's a good number. That one will not change with the weather situation or the testing, decrease of testing that we may experience. And listen, the site that is going to close does about 1,500 tests a day, a little bit more depending on volume. And we have about 4,000, 5,000 tests. So even without that site, we will continue to see a substantial that is happening in the county. But having that into consideration, again, we have to factor, and we will have to look at the data closely, and maybe when the labs were collected, to start see what the timing is and what effect it may have. But what is good about this is that we know that it's happening. It is controlled, meaning we know when it's going to shut down, we know when it's going to restart, so that we can validate the data in both directions, having that into consideration.
Kelsey Thord with West 2 News.
The only thing that I would add to that question, Steve, is that Dr. Pino and I have a conversation about the numbers at least once each day. And so from that, we make adjustments. The private providers will continue to be doing testing during this period of time, and all of the data that's derived from that is entered into the state's database. And so testing will continue within the community. And if we see that the storm itself has a minimal impact, there's a possibility that the site could reopen sooner than later. And so if the track turns differently, we have the ability to reopen those sites very quickly.
Kelsey Thord with West 2 News. This question's for Dr. Pino, most likely. If the storm does track towards our area and potentially does get stronger, are you guys worried that it could lead to an increase in coronavirus cases with people maybe congregating together, hunkering down, not going outside? Or are there any worries that you have about this storm?
No, those are interesting points. I didn't think about that way. But that's interesting. So we may have to monitor this weekend, 2 weeks from now, to see what happened with the data. But that's an interesting point. My concern with the storm will not be COVID-19. It will be having to open the shelters for people with special needs. If it gets to a level, then that will be a concern because they have a special needs. And in a congregated environment, although we will take all the steps to protect everyone that goes in there, it still is a congregated environment, so you always have those concerns. So I would be more concerned about opening shelters than what could happen with the virus, really. Because at this point, and again, I don't want anyone to be complacent on this. Our data, our pandemic here in the county is behaving in the way that we want. And if we continue this way, we will continue to bring down the positivity rate. We will continue to bring down the number of cases. We just have to be wise and stick to the protective measures that we have in place.
Buenas tardes, Félix Pirela de Telemundo. Doctor Pino, se siguen incrementando los casos de muerte, tercer día de récord, 40 de las muertes registradas el día de hoy pertenecen a la Florida Central. ¿Cómo están trabajando a nivel local para atender la situación en los hospitales? Estamos en una posible crisis hospitalaria en las próximas semanas. Además, también cómo se están trabajando los casos que se están reportando en los ancianatos, doctor.
The question in Spanish was, with the elevated number of deaths and cases, do we have any concern about hospitals? And do they, what happened with the assisted living facilities and what are the next steps? Con respecto a los hospitales están en muy buena situación. Por ejemplo, tenemos hoy casi 70 camas en cuidados intensivos disponibles y tenemos más de 900 camas disponibles en general. Esos son números importantes. Y también el Estado ha tomado medidas para poder mandar a la casa el mayor número de gente posible que están en los hospitales que ya están listos para darse alta. Con respecto a los Assisted Living Facilities, tenemos un protocolo que seguimos en todos y es el mismo que estamos siguiendo en todas estas facilidades. El Estado está haciendo pruebas sistemáticamente en todas las facilidades. Incluso cuando detectamos outbreaks, hacemos pruebas a todo el mundo. Enviamos enfermeras que se dedican al control de infecciones para determinar cuáles son los pasos que tienen que tomar para corregir cualquier violación que hayan tenido con respecto al control de infecciones. So the answer in English to that question was, with regard to the assisted living facility, we have existing protocols that have worked very well. They work in Green Tree and have worked in other facilities, which is basically test periodically, isolate, treat, and retest again in 2 weeks or a week after to pick up any additional cases. Now, many of these cases that I'm telling you, although those are elevated cases, many of those cases are asymptomatic individuals. So those are individuals that we detect because we are testing. And there is an element of that. The more you look for it, the more you are going to find it. Now, it is important to detect asymptomatic individuals because then you can act and prevent the outbreak from growing any larger. And we have those protocols in place.
Okay, I have one question, Mayor Demings, for you, coming from Ryan Lynch with the Orlando Business Journal. And Ryan's asking, with the small business grants, how may the county look at expanding the eligibility criteria further if needed?
Well, what we did with the small business crisis assistance, we expanded the eligibility from those who had not received more than $50,000 in PPP, Paycheck Protection Program dollars. We expanded that to $75,000, and we also expanded it again to those sole proprietorship types of home-based businesses. Again, 3 or fewer employees, whereas before they were not eligible. So by doing those 2 things, we know that there is a certain number of additional persons who have made application that will qualify under that criteria. So we'll put that in place, and then we'll see what kind of demand we drive as a result of that. And if we have additional dollars, we would likely expand that or roll those dollars into other potential expenditures. We have until December the 30th of this year to expend those CARES Act dollars. So timing and time is of the essence that we get things moved along in order to make certain that we don't leave any money on the table.
Thank you.
So I will, before we conclude, this, as we talk about the spread of the virus, I always like to do this because going back to mid-March when we went under a state of emergency, and I would ask the question of different audiences, how many of you in the audience would know someone that tested positive or who had died as a result of the virus? And at that time, virtually there was no one in the audience. So I'm going to ask a question today to those of you, the media, who are here. By show of hands, how many of you know someone that tested positive? Would you show your hands? Okay. So how many of you know someone that has died as a result of the virus? Raise your hands. Okay. So you can see that in terms of the spread of the virus within our community, it has, after 4+ months of this, how it has really affected the entire community. And so as time moves forward, more of you will raise your hand, if not 100% of you will eventually know someone who has tested positive or who died as a result of the virus. So with that, to those who sometimes question the medical science behind this and suggest that this is a hoax for political reasons, I remind them that this is very real that we're dealing with. And so each time we give these press updates, we do so with the intent of trying to stop and slow the spread of the virus here within our community. We don't want you, those of you who are watching, to become one of those numbers or one of those people who have been directly impacted. And that's the goal that we have in mind. That is the ultimate goal that we have in mind. Our decisions here are not decisions made based on politics, but decisions based on public safety. And so in consultation with our medical community and the bright minds like Dr. Pino, we're going to continue to try to make the best decisions that we can make on behalf of the citizens here in Orange County. So thank you all for attending today, and we will see you at the next update.